Hello, welcome to HMIS 101A, Entry and Exit in the UDE Assessment for Singles Only. I am your trainer, HMIS Systems Specialist, Shantae Smith. During this training, we will be discussing on how to complete a UDE assessment and how to enter and exit your client from your project. If at any point you have any questions, please contact the HMIS Help Desk at hmisupport@cir.org or by phone or text at 602-908-3605. Thank you, and let's get started. Once you log into the system, at the top right corner, you will be clicking on Enter Data As. This will allow you to enter data as into the project your client is going to be served from. In this case, I am shadowing an HMIS test agency, therefore I will not need to EDA. Please note, according to the HMIS Data Quality Plan, you have 7 calendar days to enter in brand new client information. For training purposes, today we will be backdating to January 1st. So once you click on the Backdate module, this box will appear. Once this box appears, please click on that blue circle with the arrowhead to clear it out and type in the date you wish to backdate to. Please note that the timestamp does not necessarily matter as long as this actually reads PM instead of AM. Then you click Set Backdate. Your banner will turn bright yellow to let you know that you are currently in backdate mode. If it does not, that is okay as long as you have the hyperlink located to the right. Next, we will go to Client Point. As discussed in HMIS 100, this is where you will begin your client search to see if they already exist within the system or if we have to create a brand new record. So again, today's example begins on January 1st of 2017. Our client, Lily, presents to us for assistance. So we go to the system to see if she's available. Once I get to Client Point, I will type in her first name, Lily, and her last name, HMIS Test. Since Lily presented us with her full name, we are going to use the category of full name reported. Please also note that you have other categories as partial, street name, or code name reported, client doesn't know, client refused, and data not collected. Take note that client doesn't know means that the client does not know the answer to this question. Client refused means that the client refused to provide you the answer to this question. Data not collected is you, as the interviewer, did not ask the question. These 3 options are available throughout the system. Please use them sporadically. Again, for this example, our client reported a full name reported. Underneath it, it says alias and you have a box listed there. In the event that your client reported to have a secondary name, please go ahead and list it here. Underneath it, we have the area for a Social Security number. Please document what your client reports to you. And then complete the Social Security number data quality. And in this case, it is a full social reported. If your client does not report their Social Security number and reports that they don't know it or they refused, please choose one of those options, but leave this area blank. We advise to not list all zeros. Next, you have this question, U.S. military veteran. This is to be answered for all individuals over the age of 18. She reports to us that she is not a veteran. Underneath that, you have this box that says exact match. Don't check that box because if you do, it will only search for what you typed in exactly. It will not pick up any misspellings of the sort. Once you have this information listed, go ahead and click the button that says Search to see if your client already exists within your system. Down in our client results section, our client, Lily HMIS Test, does not exist. Therefore, we're going to create a brand new client record for her. To do so, we will click on this button that says Add New Client with this information. Once you do, you will get a warning box and it's asking, are you sure you want to add this client? And you can click OK. Once you click OK, it will take you to your client's HMIS profile. The number on the top left in the parentheses is your client's HMIS ID number, and it is how they will be identified. The screen will automatically default to your client summary tab. You can now click on the Client Profile tab. In the first box you will see is the client record. The pencil to the left of Client Record is a universal Edit button. By clicking this pencil, you are able to edit the information listed here. The box to the right is a space for your client's photo. With a photo release form and your client's permission, you are able to take a photo and document it here. Underneath Client Record, you will see the box that says Client Demographics. We advise you to never touch this box. Please do not add, edit, or delete any information here. Your client demographic information will actually be completed on the assessments through the EntryExit tab. Underneath Client Demographics, you will see a box that says Arizona Client Notes, as well as a box that says Client Notes. The difference between the two and the functions are further discussed in the Case Management series. Underneath Client Notes, you will see a box that says File Attachments. This is where you are able to attach a file to your client's record, such as birth certificates, Social Security cards, ID numbers, or case management paperwork. Underneath File Attachments, you will see another box titled Incidents. This is further discussed in the Case Management series. If you scroll up to the screen, the next tab you will see is the Households tab. This tab is for projects that serve family groupings, and you may see a list of names here, but since you are a singles project, you do not have to worry about it. Next to Households is the ROI. This stands for the Release of Information. All clients in the HMIS system must have a signed release of information, either giving you permission to share their data or they deny permission to share their data. Once you have that document signed, you will click here on the ROI tab, click on the button that says Add Release of Information. The provider should already default for you. Release Granted. This is where your client either grants you permission, or denies you permission. And please note that this is valid for 1 full year and must be completed every year thereafter if they are being served by your project. Then you will list the type of documentation. This should be a signed statement from your client, but there are other options. For the witness information, you can list yourself as the witness. And then you click Save Release of Information. By doing so, you see that we do have permission to share our client's data within the system, and it is also listed here. The next tab you will see is the EntryExit tab. This is where you will enter, exit, and update your client's record during project stay. Next, you will see the Case Managers tab, where you're able to assign yourself as a case manager, and the Case Plans tab, where you are able to develop case plans with your client. These two tabs are further discussed in the Case Management series. Next, you will see the Measurements tab. This tab is for completing SPDATs and family SPDATs and self-sufficiency matrices. Above Measurements is the Service Transactions. This is further discussed in the Case Management series. Please go back to your Client Information tab and click on the EntryExit tab, and now we will begin to enter our client into our project. Once you click on the EntryExit tab, you're going to click on the button that says Add Entry Exit. Once you click on it, the entry data screen will appear. Your provider automatically defaults, and please note that this should match what you have EDA'd into, assuming you are in EDA mode. Then, your type will be HUD unless otherwise specified. Your entry date will default to the same day you have backdated to. Please do not manually change the date here. If it does not match, please get out of the screen by clicking this X and enter into backdate mode through the module located at the top right. Once you've verified this information is correct, please click on the button that says Save and Continue. At the very top, you will see your provider listed as well as your type, and your client will be listed here in the household members. Below that, in the Select an Assessment pane, you will see that it is defaulted to the assessment you will need to complete, the UDE Assessment. The UDE Assessment stands for the Universal Data Elements. Please note that this assessment is required for all clients. Now we will begin to enter in the data as reported. The first question we have is relationship to head of household. Since we only serve singles, our option would be self-head of household. Next, you are required to report your client's date of birth. Our client reports to be born on August 30th of 1985. Therefore, their date of birth type is fully reported. Please note that in the event that your client does not report their full date of birth and only gives you their age, please use the date of birth as the month of 01, the day of 01, and the birth year as their approximated birth year dependent upon their age, and then document the date of birth type as approximate or partial date of birth reported. Again, you also have the option of client doesn't know, client refused, and data not collected. Next, you will complete your client's primary and secondary race. Please note that we have American Indian or Alaska Native, Asian, Black or African American, Native American or other Pacific Islander, white, client doesn't know, client refused, and data not collected. Please refer to your handout in reference to the primary and secondary race. We say this because, according to HUD, if your client reports to be of Hispanic or Latino descent, their primary race would be white. Their ethnicity would be Hispanic Latino. If your client reports to also be of Middle Eastern or European descent, their primary race would also be white, and then their ethnicity would be non-Hispanic, non-Latino, or Hispanic Latino, depending on if they had Spanish origins. There is the available box to document whether or not your client has a secondary race. Please only use this box if your client reports to be biracial. Next, what is your client's gender? Female, male, transgender, male to female, transgender, female to male, does not identify as male, female, or transgender, client doesn't know, client refused, and data not collected. Then we have the question of, does your client have a disabling condition? At this point, we are not asking the disability that they report. We would just need to know if they have one. If you are unsure of the disability types currently recognized by HUD, please take your cursor and hover over the question, and a pop-up window will explain. Next, we have these questions in reference to our client's length of time on the street, an emergency, shelter, or safe haven, and their history of homelessness. The first question we begin with is residence prior to project entry. This means, where did your client sleep the night before they checked into your project? We have place not meant for habitation, emergency shelter including hotel or motel paid for with emergency shelter voucher, safe haven, interim housing. If you are unaware of the definition of interim housing, please contact the HMIS help desk and we will explain further. Next, you have institutional situations such as foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, jail, prison, or juvenile detention facility, long-term care facility or nursing home, psychiatric hospital or other psychiatric facility, substance abuse treatment facility, or detox center. Finally, you have your transitional and permanent housing situations, such as hotel or motel paid for without emergency shelter voucher, owned by client with no ongoing housing subsidy, owned by client with ongoing housing subsidy, permanent housing for formerly homeless persons, rental by client with no ongoing housing subsidy, rental by client with VASH subsidy. VASH is Veterans Administrative Supportive Housing. Rental by client with GPD tip subsidy. GPD tip is Grant Per Diem Transition in Place. Please note that these are both veteran-specific projects. Next, you have rental by client with other ongoing housing subsidy. Other ongoing housing subsidy would be Section 8 or rapid rehousing. Residential project or halfway house with no homeless criteria. Staying or living in a family member's room, apartment, or house. Staying or living in a friend's room, apartment, or house. Transitional housing for homeless persons, including homeless youth. Client doesn't know, client refused, and data not collected. Our client Lily reports to us that she had been sleeping on the streets the night before coming to us for assistance, so the option we will select is place not meant for habitation. The next question is the length of stay and previous place. How long had our client been staying at that residence prior to project entry? Lily lets us know that she's been there since the beginning of December of 2016. So then we have the option of 1 month or more, but less than 90 days. Please note you have other options such as 1 night or less, 2 to 6 nights, 1 week or more, but less than 1 month, 90 days or more, but less than 1 year, 1 year or longer. Client doesn't know, client refused, data not collected. The approximate date homelessness started refers to when did the most current episode of homelessness begin. Again, our client Lily reports to have been sleeping on the streets since December of 2016. So this here would be 12/01/2016. Then you have the question of, regardless of where they stayed last night, the number of times the client has been on the streets in emergency shelter or safe haven in the past 3 years, including today. Lily explains to us over the past 10 years she's been in and out of shelters and on the street. So we have the option of 1 time, 2 times, 3 times, 4 or more times. Client doesn't know, client refused, data not collected. Then you have the total number of months homeless on the street, an emergency shelter, or safe haven in the past 3 years. You have the option of 1 month all the way to 12 months, or more than 12 months. Since Lily explains to us that it's been the past 10 years, our option would be more than 12 months. Please note that if a client reports to sleep on the street, an emergency shelter, or a safe haven for 1 night in a calendar month, they are considered to be homeless for that entire month. Next, you have zip code of last permanent address. HUD would need to know where your client was last permanently housed for 90 days or more. If you and your client are unaware of the specific zip code, take your cruiser and hover over the question, and we have provided you with a cheat sheet for generic zip codes and counties within the balance of state area. Please feel free to use one of these zip codes if they are unable to give you the exact zip code themselves. Then you have this question of client location. There is only one option, so please do not skip it. Once you have answered all of these questions, you can click Save and Exit. By clicking Save and Exit, it returns you to the EntryExit screen to show that you have an entry into your project as of January 1st, 2017, and your client count will show 1 because it is your 1 client that is checked in. Now, let's fast forward in time. Let's say that our client is going to be exiting our project as of today, real time. To enter in that data, we will first do so by turning off our backdate mode by clicking on that red circle to the right of the backdate. Once you turn it off, it brings you back to present day. Next, through your EntryExit tab, you will click on the pencil to the left of the blank exit date, and your Edit Exit Data screen will appear. Your exit date will automatically default, and then you will choose the reason for leaving. You have completed program, criminal activity or violence, death, disagreement with rules or persons, left for housing opportunity before completing program, needs cannot be met, non-compliance with program, non-payment of rent, other, reached maximum time allowed, unknown and disappeared. Our client Lily has actually completed our program and is moving into a transitional living facility. Therefore, we will complete the destination to identify as such. Please note that the destination list is almost exactly like the residence prior to project entry list with a few additions, such as deceased, move from one HOPWA funded project to a HOPWA PH. HOPWA stands for Housing Opportunities for Persons with AIDS. PH would be permanent housing. Move from one HOPWA funded project to a HOPWA TH. Again, HOPWA, Housing Opportunities for Persons with AIDS, and then TH, Transitional Housing. Then you have staying or living with family or friends, permanent as well as temporary tenure, a safe haven, other, no exit interview completed. Once you have selected your client's destination, and please remember that this is extremely important not only for project outcomes but for continuum-wide reporting. Click Save and Continue. Once you click Save and Continue, it automatically defaults to your Universal Exit Assessment, where you will document your client's income, non-cash benefits, health insurance, and disability information as it's been reported to you. Lily does not report that she is covered by health insurance, so we will list data not collected, and then click Save and Exit. Once you've clicked Save and Exit, you'll be returned to your EntryExit screen with your exit date listed. This will show you that your client has an entry and exit into your project for these specific date ranges. Go over a few key points. According to the BOS HMIS Data Quality Plan, you must enter in brand new client information within 7 calendar days. The U.S. military veteran question is initially answered on the client search screen, but it also can be answered on the client profile screen. When creating an entry, you must go through the EntryExit tab. Client demographic information should never be recorded on the Client Demographic section on the Client Profile tab. HUD considers the zip code of last permanent address to be 90 days or more. When creating an exit, be sure to go through the EntryExit tab and use the Edit Exit pencil icon to exit your family from your project. Interim housing is not a type of housing, but rather a housing situation where a chronically homeless person has applied for permanent housing, has been accepted, and has a unit or voucher for permanent housing that has been reserved for them, but for which there is some other situation that prevents them from moving in immediately. In such cases, where it has been determined to be absolutely necessary that to keep the client engaged and moving towards housing, a temporary solution must be utilized, and transitional housing is used. So the client should be identified upon move-in into the permanent house as coming from interim housing. As a reminder, if you have any questions, feel free to contact us at the HMIS Help Desk via email at hmissupport@cir.org or by phone or text at 602-908-3605. Thank you so much for attending, and please refer back to your training confirmation email for further instructions.